Capitol Report is a production of Senate Media Services.
This week, lawmakers look at ways to turn the tide on rising prescription drug prices, plus a doctor's perspective on teen vaping and a close-up look at the beautiful and historic Governor's Reception Room. Stay tuned for this and more on this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. Last summer, the Trump administration announced a dual-pronged plan that could lower the cost of prescription drugs. This fall, Senator Michelle Benson, chair of the Health and Human Services Committee, held listening sessions around the state to hear from Minnesotans directly about managing their prescription needs. She now joins me in the studio. Thanks for being here.
Glad to be here.
Before we go into the details of the administration's plan, tell me about these town halls. What are Minnesotans concerned about? Are they really struggling with these prescription drug costs?
Well, we've seen as policymakers and as somebody who watches the insurance industry that prescription drugs become a larger and larger part of the cost of health care. Some of that's good. If a prescription drug is keeping you out of the hospital, it's actually lowering the overall cost of care. But because there are high deductibles and co-pays, a lot of people are feeling the direct impact of the high cost of their prescription medications. And we're hearing that there are new seizure medications that came out in 2018 that are revolutionizing the way seizures are treated, but they're expensive. They're new. British company rolled them out, and it's painful to hear people talk about how they can't afford this latest medication and how the other ones aren't necessarily working for them. And so it's good motivation for us to keep pushing on this issue.
The first prong of the Trump administration's approach would allow states to import certain drugs from outside the U.S., places like Canada. Many prescription drugs are significantly cheaper in Canada. So what would Minnesota need to do to gain access to these lower Canadian prices?
Well, we would have to allow, it's the mechanism of a wholesaler in Minnesota having a partnership with a wholesaler in Canada, because we want to make sure we have full traceability and trackability on these drugs. It's important for safety that they not be adulterated drugs that came in from another country. So we want to make sure we know where they came from the manufacturing process all the way to reimportation. And so that's going to require some legislation, and it will require us to have our Board of Pharmacy do some inspections at those wholesalers and verify these relationships. And so we're working on language now, and we're working with all the stakeholders who would be impacted by this. And there's some openness to it, but as with everything, there's concern about how it's actually going to work when it's implemented. If you remember, the Pawlenty administration started doing this.
I was going to mention that. Yes.
Yes, and so we have some of that legacy here in Minnesota, but with the 2013 Safe and Secure Drug Act, we have this added wrinkle of full traceability, which I think Minnesotans want. They want to know their drugs are safe in the supply chain.
Now, which drugs qualify for this? Because it's not all, is it generic, is it name brand? Does it affect insulin?
Well, and it would have to produce significant savings. It couldn't be infusion drugs. And the question about insulin is it a biologic or is it a drug? So we have conflicting parts of code right now. And when we asked our colleagues in the federal government, which one is it, because we see it in two places, they said, well, we'll get back to you. So March, we're supposed to have an answer, because it's not just Minnesota that it's impacting. It's the industry and how it's defined, how insulin is defined. But there would be, it would be limited drugs, because Canada doesn't have the full formulary that Minnesota has. Probably not generics, because we already have cheaper generics than they have in Canada. Nothing that would be given in a hospital or in an infusion center. And so it's not a panacea. We're not trying to sell it as that. What we're trying to do is get the pharmaceutical companies to stop treating Canadians better than Minnesotans. We want to be treated fairly. So if you can get an Advair disc in Canada for $6 and it's $60 here, that's not fair. So let's figure out how we get pharmaceutical companies to change that behavior. And if this is what it takes, this is what we'll do.
The other part of the Trump administration plan, the second pathway, would allow pharmaceutical companies to verify that their foreign-produced drugs achieve the same safety standards and protocols as American counterparts and then offer those foreign drugs for sale in the U.S. at the lower price.
Right.
What is the incentive for the pharmaceutical companies to want to do this?
Well, first of all, they need to treat Americans fairly. And I think having these intense conversations about the cost of prescription drugs is resonating with some of the pharmaceutical companies. But they're kind of stuck. Let me tell you why. There's something called a national drug code, and all of the rebates that are required at the federal level peg off that national drug code. And so, for example, you'll have drugs that have 4 different categories of federal rebates. They put a price on the national drug code, and in the private market, that price is what you see, even if you're not getting the federal rebates. But if they put a different national drug code, those rebates at the federal level don't apply, so they can actually just lower the price and make it more transparent for consumers. And so there's some interest. We have started talking with pharmacies to see how this would work for them, distributors to see how it would work for them, and we want to sit down and partner with some manufacturers who are going to have the biggest impact. And it's not just their foreign produced drugs. There are drugs that are produced here in the United States that are labeled for foreign sale in Israel and Ireland. They could just give them a different national drug code, avoid this whole rebate mess, and make it available at point of sale at pharmacies.
Now, pharmaceutical companies do have an interest, though, in a certain amount of return on their investment for research and development. So how is there a balance? How do you balance that?
And we want them to be sustainable. That's how you come up with new seizure medications. That's how you come up with new medication or drugs that treat specific genetic disorders. And so we don't want to have a chilling effect, which is what some of the foreign countries' behaviors actually have a chilling effect on R&D in their country. And so by letting them have this second national drug code and not be subject to the rebates, there are some rebates where the state of Minnesota actually gets more in rebates than we spend on the drug. And so the manufacturers, this gives them a back door. It gives them a different way to get the necessary pharmaceuticals to the people who need it at a price without the rebate game.
Do you expect there to be bipartisan support for this?
I think because we're moving into an election year, my hope for bipartisanship is slipping a little bit, but I hope that I can put forward a reasonable, well thought out bill language that somebody could look at and say, okay, we can live with this. And if it doesn't pass this year, we can bring it back when it's less political and when it's not an election year.
Senator Michelle Benson, always a pleasure.
I'm glad to be here. Thanks for having me.
Saying that a self-imposed 30-day deadline had passed for an insulin affordability plan, Governor Tim Walz and DFL lawmakers advocated moving their private discussions into public hearings.
I understand that sometimes in delicate negotiations there's a need to maybe step back and see if you can compromise. We've tried for 30 days. My understanding is Friday that an offer was tendered but was not able to be accepted. So whether we made some progress, you maybe have to speak to the folks who are in that room, but not far enough to be able to have an agreement. And I think what's missing in this is the public eye. I think it's the eye of the folks in this room, in the media, being able to be there. And a hearing is very different than a negotiation. A hearing allows us to bring in advocates, to bring in experts, to hear different sides of the story. And I think what my concern is right now is that we've fallen over these 30 days a little bit into camps again, and it's time to break from that. I think that the Democratic plan that Representative Howard and Liebling and that they moved on, that they voted on, I think is a solid plan, and that's certainly, I think, the way I'd want to go. But that's not the way this works. I'm willing to compromise, and there may be the capacity, which I really liked about this working group, and I do think it did some of this. It expanded our vision beyond emergency triaging of insulin to long-term costs and sustainment.
You know, our proposal would make sure that Minnesotans in crisis could enter their pharmacy and secure a supply of insulin that day. But we would also ensure that a navigator follows up with that patient and connects them to long-term resources. We would insist that insulin manufacturers pay for this program, And as soon as we pass a bill, that's when we can start setting things up. I mean, I think that's the biggest impediment to setting something up quickly is legislative action. So from our perspective, this solution is staring us right in the face, and it's time to call the question in front of Minnesotans, where do you stand?
It's time for a public hearing where we can hear from experts, from advocates, and Minnesotans most directly impacted on the two proposals. A public hearing will provide transparency and help us move forward in the most productive manner. This can't wait any longer. Together, we can find a solution that includes ideas from the House and the Senate, as well as advocates, and that includes DFLers and Republicans alike.
The skyrocketing costs of prescription drugs and the rise in teen vaping continue to make headlines both nationally and in Minnesota. Joining me to offer his perspective on measures to address these concerns is physician and Senator Matt Klein. Thank you for being here.
Thanks so much, Shannon.
Let's begin with prescription costs, because the Trump administration proposed a rule change over the summer that would allow states to enact plans to import drugs from other countries like Canada that have lower prices. A handful of states have done this. Is this something that Minnesota should do?
I think we should fix what's wrong with drug pricing in America and in Minnesota and not try to go around the system by getting drugs from Canada. I have worked very closely with Republican Scott Jensen, the other physician in the legislature, on some sort of drug pricing oversight commission, similar to the Public Utilities Commission, where we could investigate if the cost of a certain medication, like an epinephrine pen or insulin, for example, went up by 400% in a year. This commission would be charged with looking into that. Is that cost justified? Is it comparable to market rates? And if it's not, if it's gouging or extortion, then they would have some power to punish or impose penalties on that. I think that's the only way we're going to get to the bottom of this type of balance between the for-profit drug manufacturing industry and the needs of humans in Minnesota to receive necessary medications.
This week, by happenstance, an ad came through one of my social media feeds from pharma, making the point that America leads the world in medical innovation and producing half of all new medicines. And medical innovation isn't cheap. Some of these drugs cost billions of dollars to develop. And so I would assume that they would argue that there's some recouping of their cost that needs to be done. So how do you balance that innovation with prices that people can afford?
That's the fundamental question. And as a physician, I am incredibly grateful to the pharmaceutical industry because they create the miracle drugs that allow me to do my work and save Minnesotans. And without them, without their sort of drive for innovation and profit, candidly, we would not have those innovations, and those are great drugs. The problem is, and they quite appropriately are driven by profit to manufacture and generate those things, and then once available to drive up the price as high as the market will tolerate. But once those drugs are available, as a society, we have a moral obligation to make sure those drugs are available to everybody, regardless of income or means. So how do you balance those two imperatives, Shannon? How do you balance a for-profit industry with our social obligation to our own citizens? And again, I think it's by creating some sort of oversight board that reconciles those two imperatives and tries to find a middle ground.
Do you believe that the new legislation that will come online soon that will shed a light on the PDMs, the pharmacy benefit managers, do you think that will make an impact in the future?
I do. So that's one step in the chain. It's not a complete solution, but it at least shows that the legislature in a bipartisan way is serious about people who are sort of driving up prices within the drug delivery system. PBMs are one sort of secretive institution that not a lot of people know about, but they are a middleman between your doctor and your pharmacy, and they do contribute significantly to costs. So we've made some steps to sort of shine some light on their practices.
What do you tell patients that are struggling to afford the medications that they need?
You know, sometimes there are some very hard conversations, and I can't tell you that I always have an answer for them. We do the best we can with charitable care and with in my work at the hospital, discharging people with supplies. But there are some times where you have very real and very honest and very unfortunate conversations with patients who simply can't afford the necessary medications, and we don't have a good solution as a society for getting them those medications. And of course, you saw it with Alec Smith, who couldn't afford his insulin and died as a result. So there are not clear solutions right now, and that's what we're working on here at the legislature.
I'd like to turn now to vaping. Last week we had Senator Carla Nelson on the program. She is a proponent of measures that would raise the age to purchase tobacco to age 21 and also get rid of those kid-friendly vape flavors. Her legislation has bipartisan support. So I'm wondering if you agree with that approach in terms of getting a handle, especially on the teen vaping that is really on the rise.
So Shannon, this is very personal to me. I have 5 children. They are all teenagers, age 15 to 20, and they have described to me this explosion in vaping at their high school. And it's a real problem. The number of students who vape are escalating rapidly. At the hospital, we see people come in with severe lung injury and sometimes death. And if they avoid that outcome, then these teens are hooked for life for the next 60 or 80 years of their life on nicotine products. Raising the tobacco age to 21 is a good proposition. I have co-authored that bill with Senator Nelson, and I will continue to support it. Eliminating flavors is clearly an essential step here. Flavors are how students and teens are getting hooked on nicotine vaping, and if we eliminate the flavors, we will make some significant progress in that regard. Shannon, lastly, I've authored a bill which would create a tax on pods. Pods are these little cassettes that go into the vaping device and allow people to vape.
And they're available at gas stations and tobacco supply stores all over the state.
They are, yeah. And we proposed a $2 per pod tax. We know that the youth market in particular is extremely sensitive to economic incentives, and raising the price, by any amount causes a correlation decrease in tobacco use among youth. So I am going to continue to push for a $2 per pod tax on vaping products, and I think that might be the most effective solution to moving us towards decreased youth vaping road.
Making it more expensive, getting rid of those kid-friendly flavors, and then also raising the age limit certainly would limit the access for those kids. So as a doctor, a parent, a lawmaker, you've said you're very concerned. Beyond those measures, like what do you say to kids? What do you say to parents who maybe have a kid who's been vaping? What's that conversation?
It's really tough. So there's the pod market that is Juul and other manufacturers that people can order online and so forth. And then there's this whole sort of open device market where you can go to a vaping store and just buy a bucket of liquid and then insert it in your own device. And that is where we're getting into real serious health problems. That stuff is unregulated and unmonitored. Sometimes it contains, other recreational drugs, and it's clear that some of the byproducts of what's in those liquids is creating some of these cases of severe lung injury and in some cases death. So those products in particular are fearful, and I try to counsel my kids to stay away from them.
Senator Matt Klein, thank you so much.
Always a pleasure, Shannon. Thank you.
Since 1904, the beautifully ornate Governor's Reception Room in the state capitol has hosted heads of state and welcomed visitors. Brian Pease of the Minnesota Historical Society tells us more. The Governor's Reception Room, with its delicate woodwork, velvet curtains, and chandeliers, is probably the most intimate and ornate room in the capitol that the general public has access to. In old photos, it was arranged more like a formal living room, with the furniture style changing as the times changed. Today, it is mostly used for gubernatorial press conferences. How has this room, the use of this room, changed from 1905 to today?
Yeah, it really has seen a significant change over its use over time. At one time, the large oval table was in the center of the room, and that was the meeting room table. So when the governor was meeting with executives or legislators, that was usually where they would meet to kind of work things through. And there were desks here, so there wasn't enough room for every governor's staff person to have their own office, so there were 2 roll-top desks here in 1905. And then eventually those moved out. And as times change, the carpet would wear out, colors and styles would change, so then we would see a change of furniture here. So what we see today in this room wouldn't have been here until the 1980s. Probably from the 1920s and 30s, it was here and then was gone because they wanted to put a new carpet, put in new furniture. So when you look at the appearance of this room today, it really does look pretty close to what you would have seen in 1905.
Off to our right, there's a table that has a sign that says, "Please do not place anything on this historic table," and it's never used. Everybody always wants to know what's so special about this table.
Well, it's a table designed by the architect, Cass Gilbert. It's an oval table, one of a kind in the world for this room. And so everything that you see when you walk through the building, Cass Gilbert, the architect, had his hands in designing the furniture. So he wanted special pieces for those special spaces. And this is one of those premier pieces, a beautiful mahogany, beautiful curved details and curved wood in there. So it's really a showplace. And it would have been underneath the chandelier, so it would have been the focal point when you walked into this room. That's the first thing you would have seen was that beautiful table. And we just, it's a historic artifact, so we don't want people putting drinks or leaning on it, possibly doing damage to that special piece. Yep.
Yeah. This room is so beautifully decorated with the artwork and the woodwork, the lighting. Can you describe some of the finer details?
Yeah, there's a lot of symbols, a lot of things to remind people that this is Minnesota's state capital. So once again, you're looking at a room that's trying to talk about Minnesota's progress and prosperity in 1900. And so when you look at the details, you have decorations that talk about kind of the classical, kind of the Italian Renaissance themes, but integrated within those classical themes are North Stars for the North Star State. You have wheat and corn as part of the decoration to talk about the rich agricultural history and the present time at that time, the importance of agriculture in our state, and it still is today. And then we have pine cones and pine needles for the forest industry and the timber resources in northern Minnesota. So when you walk into this room, you're looking at the people who are building this building, talking about what was making Minnesota prosperous at that time. And it's agriculture, forestry, different industries, the history, the culture, all come together to make this a very special room in the Capitol.
The Minnesota Capitol is essentially a monument to the Civil War. And within this room, in the anteroom that you walk through, there are 6 striking paintings of Minnesota's contributions to the Civil War. How remarkable is it that there are these paintings of Minnesota's contributions in this space?
It really is a unique depiction of the Civil War of any state capital that I'm aware of. You might have 1 or 2 paintings or things that will talk about the role those citizens had of a different state. Well, here, Cass Gilbert knew he had to bring in the Civil War flags because those were always on display in the first 2 capitals. So that was a tradition you had to bring and incorporate back into this new building. But he also wanted this room to be pretty plain, kind of white enameled paint, very simple, kind of gilded, decorations. But he got pressure from the Minnesota Historical Society at the time and Civil War veterans to say, we've heard you talking about these allegorical paintings, that's good, but what about the events that we were a part of? We want those to be put in some place in the building. So Cass Gilbert redesigned this entire room to reflect those Civil War paintings and 2 other paintings that were removed recently, just to remember those men who served in those battles of the Civil War.
One of the most famous battles of the Civil War is the Battle of Gettysburg, which is represented in this room in a painting by Rufus Zogbaum. Can you tell us more about that?
Yes, it's an important part of American history because the men from the 1st Minnesota Infantry Regiment, the first 1,000 men that were tendered or offered to fight for the Union Army, and that second day of that 3-day battle were ordered to plug a gap in the Union line that had been opened up by advancing Confederate forces. And by 1863, they had been in war for 2 years, and they'd been in Antietam and Bull Run and been in major campaigns in the peninsula. So they lost a lot of men in that time period between 1861 and 1863. So their fighting force was pretty small speaking when you're looking at thousands of men in the battlefield. They had less than 300 men. And they knew when they got that order to plug that gap in the Union line, they had to fix their bayonets. It was basically a sacrificial charge. They just had to buy time for reinforcements. Not one man wavered or flinched. They all made that charge, bought the time they needed for the reinforcements to plug the gap, but they lost 82% of their men. So 8 of every 10 of them were either killed or wounded in that 15-minute charge. And so that was the one scene that you wanted to portray in your brand new capital, the sacrifice, not only of those men, but a lot of historians and even the generals at that time said if they hadn't made that charge, the whole outcome of the Civil War could have been completely different. So that was one of the defining moments of that battle. And of course, for those men that survived, a defining part of their life.
And another painting in here is the Battle of Nashville, which is known for being one of the most realistic portrayals of a battlefield scene. There's snow on the ground, the grass is downtrodden, there's smoke in the distance, the flags are in tatters. Tell me more about this painting.
Yeah, this is considered one of the masterpieces of any Civil War art in the world. And we have it here, and that's one of my benefits. I get to see it every day when I come to work. But it really is telling you a graphic story of what it was like to be in a Civil War battle. Howard Pyle, the artist, doesn't romanticize anything. He has, you know, all the generals, all the officers are in the background. What he's portraying is those privates, the corporals, the sergeants who are making this charge across 400 yards of muddy cornfields. They were wading through that muck and the mire, getting to the Confederate defenses. And they were, once again, the 4 Minnesota regiments, the 5th, 7th, 9th, and 10th, had a pivotal part of that battle and helped push the Confederates out of their defenses outside of Nashville and help turn the tide of the battle. So when you look at this painting, it really gives you a graphic depiction of what these men were like and just the chaos. As you mentioned, the flags are shredded because there's hundreds of bullets zipping through the air, and the men are low to the ground to get under that waves of lead flying over their heads. And so when you look at, you know, I'm sure a lot of these Civil War veterans were like, wow, this is pretty accurate depiction of what it would be like to be in one of those battles. And so Howard Pyle even is an artist who liked to put himself into the paintings. And so he is quoted as saying, when I painted that Battle of Nashville painting, I would often have to step outside my studio to clear my lungs of the smoke and the powder. So he was an artist who put himself in the middle of that scene. And when you look at the drama and the intensity of that depiction, it's almost like a photograph, 1 second of time where you see figures coming into the frame and out of the frame, kind of in a blurring motion. And so it really has a huge impact on what it was like to portray a Civil War battle.
You've been here for many years and thousands of people have come through this room. What do they take away?
I think the first thing they take away is the grandeur of the space. When they walk into the room, it's pretty impressive. And it's a place where the governor has an office, but it's also a place where he addresses the public. So it's a stately room. It's a place that has had governors from different states come here, presidents of the United States, foreign leaders have visited with the governors over time in this one room. And so it really is a show place to tell people about Minnesota. And I think the governor, every governor has had a lot of pride in being able to use this space for that purpose.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.